sometimes what we really are a hospital, a ride to the hospital. Unfortunately, sometimes people don't have transportation. They don't want to use public transportation. I just need my meds refilled, so I'm gonna take a trip to the ER. They're gonna refill my medicines, and then that, once again, that takes another ambulance out of service. For something that could have, if there was community paramedicine, we have an ambulance, that goes around, let's say, from business hours, 9 to 5, going around, different houses, refilling medication.
Hello and welcome to Brax Will Let You Know, where we are using the voices in this world for the change we need in the world. Today is going to be a special edition episode for my paramedic school. We're going to be talking a little bit about the high saturation of 911 calls in the Chicagoland area. Hope you tune in. In an article entitled Calling 911, 1970 to 2014, Technology That Changed Chicago, writer Lyle expressed that, quote, in 1968, 911 became the national standard. For Chicago, though, 911 calling started in September 1976, end quote. We're able to gather that the 911 system is surprisingly less than 50 years old. But like many systems in our society, we begin to notice just how it truly affects the outside world. As great as a system as this 911 call service is, recent data has shown that it has been abused, miseducated, and devalued by many communities around North America. In a 2019 Firehouse National Run survey, it captured a total of 12.5 million calls within 2019, 9.5 million of which were EMS calls specifically. In Chicago, in 2019, there were approximately 851,769 total 911 calls. 596,807 of those calls were EMS.
How long does it take to get an ambulance in Chicago? For years, CBS 2 investigator Pam Zeckman has been reporting on slow response times.
Then last year, the city added several rigs. Now Pam wants to know if they have made a difference.
Last summer, the Chicago Fire Department added 5 new ambulances, bringing their fleet up to 80 rigs.
100 was the number we felt we needed.
Not good enough for paramedic Field Chief Patrick Fitzmaurice.
It was putting a Band-Aid on a wound that needed a tourniquet.
Was it? We compared ambulance response times provided by the Office of Emergency Management for 4 months before the new ambulances were added to the same 4 months after the addition. And we found that the average response times improved just 4 seconds after the new ambulances were added. And we're still finding unacceptable response times. Remember, the state standard is 6 minutes.
We called the ambulance and we waited.
She doesn't want her identity shown, but we've documented that it took 19 minutes for ambulance 47 to arrive when her grandmother fell and lost consciousness.
When the paramedics finally arrived, what did they say?
They first apologized for taking so long.
A 2015 report issued by the Inspector General criticized the fire department for not properly tracking response times. Not much has changed.
This is an egregious shell game at this point in time. Everybody else is wrong. They're right, but they can't explain why they're right.
The Chicago Fire Department says the numbers provided to us by OEMC are not reliable. They say they will be issuing their own report on response times in 2 months. Pam Zeckman, CBS 2 Investigators.
And right now, Chicago ranks last among other big cities when it comes to numbers of ambulances per 100,000 residents.
Lives at risk. Tens of thousands of people left waiting for medical help they desperately need. The CBS 2 investigators highlight lengthy ambulance response times. Chicago Mayor Lori Lightfoot is promising to add more ambulances as a result of a series of reports done by CBS 2 investigator Pam Zeckman.
Now Pam uncovers another problem contributing to these delays.
Chicago officials often blame poor ambulance response times on people who use them like taxis for services that are not a medical emergency. We found one example at this home. Records we obtained show over 18 months, fire trucks responded to calls 133 times. Ambulances responded 204 times, unnecessarily tying up a total of 337 emergency vehicles. That's about 4 trips a week to this one house. Paramedic Field Chief Patrick Fitzmaurice has been a vocal critic of the city's ambulance shortage and those who misuse it.
That's wrong. The bigger problem is we have done nothing about it.
Morris points to other cities that have implemented programs to cut down on unnecessary calls. Neighboring Rockford has an intervention program to help people avoid calling 911 for non-emergency issues. Shannon Kopp runs the program.
What we wanted to do was decrease the use of the emergency department and decrease the use of our ambulances going and picking up these people who could benefit from other resources.
The Mobile Integrated Health Program is found in Rockford, Illinois. Its mission statement is to promote mental health, provide access to treatment, prevent substance abuse, and support the autonomy of individuals living with chronic disease, mental illness, and substance abuse by building positive relationships in the community. The news segment shares that overall, 911 calls by program enrollees have been reduced by 42%.
We get a lot of calls for people with headaches that haven't taken Tylenol, or people who have foot aches that haven't done anything about it. Generally, we serve a population of people that don't have regular health care with a primary physician, and so they use emergency services as sort of like a delivery Walgreens, or as if they were going to a walk-in clinic. And what they don't understand is that drives the ER wait times up, sometimes over to 24 hours mark for wait times for critical patients that are trying to get in. They fill those ER beds, and then the people that really need emergency services aren't able to get at it as they need it. We like to encourage people to use urgent aids and their own personal providers as often as they can. We usually try to have some kind of a conversation with the patient about that if we can work it in without being offensive to the patient. I feel like it's helpful for them to understand that there's a whole other medical system out there. It'll get them into a physician faster and be more likely to meet their needs.
In January 2022, Indianapolis, Minnesota released a public service announcement on how and when to only call 911 during real emergency situations.
You can do a teledoc. You can visit your doctor. They don't need to be seen for medication refill. So, you see hey doc, I need my medication refill. Okay, cool. We're going to send, paramedics, on an ambulance, non-emergent, right?
Yeah.
So cool. That also, yeah.
Cool. San Francisco hosts the Street Crisis Response Team. This community interactive program is set to approach people in the community experiencing mental health and substance use crisis in San Francisco. Just within the most recent data collected for May 2023, the report reveals that there were a total of 836 client engagements within that month. Of the 836, 59% of the engagements were able to be resolved on scene. Only 21% of the 836 were actually transported to the hospital.
So I think one of the way to solve this problem is multifaceted. A lot of things need to be not lot of things need to be looked at. So for one, we talk about education. In school or billboards or news program, have a segment every so often talk about utilization of 911. In what circumstances utilize 911, so they can kind of help the situation. Another thing is have clinics or hospital that is a little bit more spread out evenly, so it's more obtainable. Like walking distance or a bus route that's more accessible. Another thing we just talked about, telehealth. You can do telehealth. People have access using their app, sign up, and they can talk to the doctor and get scripts, and that will reduce some of the not acute calls. And you've done ride time with us. You've seen how many not so serious calls that we have. I think that can help eliminate some of that. But then again, it's one of those programs that require a lot of money because we are trying to fix the problems by the root. And in order to do anything like that, it's going to cost a lot of money. And unfortunately, due to the economy and due to that healthcare is a very capitalistic and also very competitive business in America. And a lot of companies are just not willing to invest in the infrastructure like that. I think that is something that the government can give incentive, or government should mandate some sort of program, that to implement program. Like the government have to jump in and utilize and kickstart all this.
The 911 service is less than 50 years old, and there is still so much that could change in the future. I have addressed the current problems and worries that exist within the relationship between first responders and its community. I have also shared a few solutions that exist in this world that may benefit us as a whole. Of course, though, medicine is a practice, and it is forever evolving. There is no telling what the next 50 years holds for us as first responders. But as for now and forever, we are there when you need us. And this will hold true not just as a department statement, but as a first responder and a devoted human being working to make a difference one patient at a time. Thank you so much for watching. I hope you learned a thing or two. Once again, this was Brex Will Let You Know, where we are using the voices in this world for the change we need in the world, one voice at a time. Thank you. See you next time.